Your country is planning a supplementary immunization activity, or SIA, for measles. The SIA is targeting children of a particular age group in underserved populations in your district, including some religious communities and nomadic groups. The success of this SIA relies on a clear communication plan to reach these communities. Communication is a key part of any SIA and is needed to get support and participation of decision makers, communities, and caregivers. While a plan to address communication priorities for SIAs is developed at the national level, as a district or subnational manager, you will be involved in guiding microplans in your area. Planning for communication should begin early, at least 6 months ahead of an SIA, and should include communication activities for before, during, and after the SIA. Start communication efforts 2 months before the planned SIA and intensify them 2 weeks before the SIA begins. When planning communication for SIAs, use the same process you would use to develop any communication plan. In this video, we will focus on some key strategies for planning SIA communication. Every SIA communication plan should include strategies to promote awareness and demand among caregivers, especially in underserved populations, advocate for support from public leaders or decision makers, partner with religious, social, and civic groups, and train SIA staff to communicate effectively. How can you promote an SIA? One of the main goals of SIA communication is to ensure that all parents are aware of the campaign and motivated to participate. Consider how you reach each community. Focus efforts on places people frequently visit. Put up posters, banners, hoardings or billboards, or use criers or microphones in marketplaces. Focus on communication channels commonly used in the community, such as sending SIA reminders by text messages. Prepare promotional materials such as posters and banners. Also, identify ways to raise awareness through mass media, such as TV and radio spots. Keep in mind that while media can reach a large audience, traditional personal methods can often be more effective. How can you advocate for the SIA? As you plan for an SIA, advocate to local political, religious, and community leaders and opinion makers. They can provide support and build community acceptance for the campaign. Meet with community leaders and health practitioners to educate them on the benefits of SIAs and vaccination against the disease. To help with these efforts, prepare briefs to share information on how SIAs can reduce death and disease. Look for ways to partner with existing groups to support the SIA. Work closely with local NGOs, schools, community groups, or other organizations to help reach your audience. Ask partners to share ideas to mobilize key groups. They can also help you tailor your messages so they are relevant and effective for these communities. When reaching underserved populations, look for ways to partner with leaders and volunteers from these groups. For example, they can help conduct home visits and community meetings to motivate caregivers. Finally, be sure everyone involved in SIA communication is properly trained. Make sure communication activities are part of SIA training for mobilizers, vaccinators, and supervisors. Training should ensure that health workers, vaccinators, and mobilizers know key messages for the different groups. Provide handouts or checklists with these messages to help SIA staff interact with the community. Training should also provide guidance and practice on interpersonal skills, especially when dealing with non-cooperating or refusing parents. Make sure all vaccinators are ready to explain that during SIA vaccination days, all in the target age group need to be vaccinated, regardless of their history of vaccination or illness. Now you know some key strategies to consider As you plan communication activities for SIAs,